Hey, what's going on, guys? Welcome back to the channel. My name is Robert Thompson-Eshun. I'm a final year pharmacy student at St. John's University. So in today's video, I'm actually going to go over my internship in health administration. So before the video even starts, I suggest you guys actually watch my last video where I talked about how to actually get an internship in pharmacy school. And the main point I said in that video was building relationships, which is how I actually got this internship. And it's very, very important because now I can use that connection if I want to pursue a career further down the line in health administration if I choose to. So in this video, I want to go over how I actually got my internship, what I actually did / what happened in my internship, and then what I actually learned in my internship. And I'm also going to include a bonus part at the very end of the video, so stay tuned for that part as well. So that being said, how I actually got my internship. Basically, I got my internship through my school. My school is actually having an event where they had a lot of executive leaders from different health systems and different organizations come by and talk to us because we were going through our final year. And it's very important, to kind of figure out where you want to be at or like kind of know what direction you want to go to. But unfortunately, I was not the kind of person I know what I wanted to do. So I ended up going to this meeting, and obviously the executive leaders, they were very nice, very kind. But I kind of felt like, I didn't understand what's going on. And for me, I'm kind of a hands-on person, so I kind of was like, okay, you know what, I'm going to just ask some questions. So after the meeting ended, I actually emailed a couple of them and asked them a couple questions about their jobs and like how I actually could have learned more about it. And it's funny because like I asked so many questions, they were like, just like schedule a Zoom meeting with me. So I actually scheduled a Zoom meeting with them, and I actually talked to them one-on-one a couple months afterwards. And during that meeting, I was still very curious. I felt like I still did not get the grasp of things because I felt like the business side of healthcare is so important, but it's never talked about. And I feel like I want to learn more about it as much as possible. So in that meeting, I actually asked them for if I can get any tangible experiences in the health system, and they actually agreed upon it and let me do it. So that's how I actually got my internship, just being naturally curious and just wanting to talk to that person and just asking them a lot of questions. They saw that I was very motivated, I was very curious, and I just felt like I could learn a lot more. And that's how I got the internship. So now that I went over how I actually got my internship, I want to talk about what I actually did / what happened during my internship. So during this time period, I think it was around like July, August, like that time period of around before fallish time period, and a lot of things were going on. So my main job as an intern was just like be a fly on the wall and learn as much as possible from everybody I could. So I basically had a time where I was going to different hospitals or being with different executives every single day, and I got to basically just ask them questions, see what they're doing, being part of crucial conversations they were having with their team, which is pretty cool. So the main thing I want to talk about what happened during my internship was, first of all, the COVID-19 vaccine mandate that was going on. That was a time period when the vaccine has been out for a couple of months now, since it came out in December, and people were still not getting the vaccine, and New York City was actually starting to enforce the mandate. So this is a time period where a lot of people were going to get laid off, and a lot of the executives that I was working with or like on the shadowing were basically trying to figure out how are they going to still operate as a team without all these people around, and that was pretty a trying time for them, and just like talking to each other in terms of like helping people maybe get on board to the vaccine. If they were not getting a vaccine, how are we going to replace them? What are we going to do overall? Because a lot of people got laid off during that time period. And also on top of that, they were actually doing their annual financial reports, which basically is them talking about how they actually were managing their money. So everything that goes on in the hospital system has to get managed through money. So it's they have to basically say, are they making money? Are they losing money? What are the things that like they need to improve upon? And just reporting that to every single person, which takes a long time, and it goes through a lot of revisions. And I got to learn about like FTEs, which is like full-time equivalents. So basically, when a person works full-time, that's the full-time equivalent. And how many full-time equivalents do we have in our system right now? And if people are actually going to get laid off as well in that situation, because during that time period, COVID-19, a lot of hospitals were actually getting money from the federal government, other places as well. So people were actually allowed to have a little bit more people on board. So now they're trying to figure out, okay, can we actually sustain this amount of people in the future? Or how are we doing in the past? And they constantly look at the past, the present, and the future in terms of figuring out how to manage that money aspect, which is pretty interesting to see each hospital manage that. So those are the two main things I went through when I actually went around in the health system. And on top of that, I got to ask a lot of executives questions, which is what I'm going to go into now, which is what I learned from my experience in the health system. So I think the most important thing I learned about the business side of healthcare is just understanding the word KPIs, which is like key performance indicators. So key performance indicators are basically key metrics that are utilized for every single person, basically. It basically says how productive and what's your performance like in the last couple of months or year. So every single person has KPIs in terms of physicians, pharmacists, nurses, executives. Every single person has KPIs that they need to adhere to. And it's very important that you understand what your KPIs are, understand what the other person's KPIs are, and talking to that person as well, because it's very important to understand how your actual performance is being measured. In terms of if you want promotion, if you're not trying to get fired, every single aspect of it is basically saying how is the business side of your system working. And even though it can be controversial for some people because some people don't feel like some of the key metrics actually translate to patient care, it's still important that you understand them to actually understand if you're actually doing a good job to your boss. And on top of that, I actually got to see the reliance on data, which is something I thought was very interesting when I actually got there, because everything is being tracked. Like literally every single thing that you're going to the hospital system is being tracked, and they use that to try to make sure they're improving on things, as well as making sure they're trying to make sure they don't have any problems in the future. When I went there, I actually got some projects in terms of working with pivot tables in Excel, and basically I was using the pivot tables to see which hospitals are underperforming based on other hospitals, and from there we're using those metrics to see, okay, since this hospital is doing bad in certain areas, what can we actually do from this hospital over here that they're doing so well at that the other hospital can utilize so they can do a lot better in terms of those metrics. So the reliance on data is actually very important as well for patient experience that I saw. So patients get asked a couple of questions did they get treatment correctly? Did people talk to them correctly, explain to them in a way they can understand it? Did they understand the medication they're taking afterwards? As well as other things like how the hospital tracks, how long did they stay, what was the diagnosis, all those important things go into one thing. And just seeing there's so much data that is being laid upon in the hospital system, and they're trying to use it to make sure they're constantly making improvements and constantly making it a better system and trying to make sure they prevent any other bigger issues in the future. And on top of that, I got to see also how insurances are utilized in the system, because most hospital systems rely on insurances to actually help them pay off a lot of the costs that are being applied to their patients. So just making sure that your hospital meets the criteria of quality assurance and constantly is trying to make patient care as good as possible based on the standards that are in play from all of our major improvements in the healthcare system. So the last thing I think I learned mostly was the reliance on soft skills, which is something that's not talked about a lot in school, especially in pharmacy school, because it's so important to have a lot of these soft skills that are in your business, because no matter where you go in your professional career, you're going to require to be a leader or required to be a leader in some aspects, where you're going to have crucial conversations with people, you're going to have to negotiate with other people, and you're going to have to learn how to actually work with people that may not want to work with you, and learn how to actually make a positive outcome from a negative outcome, and how to be calm in certain situations. And also during the COVID situation, you have to have a lot of empathy, because a lot of people are going through some trying times, and you never know what someone else is going through. So you constantly have to manage those different skill sets of soft skills and use that in your workplace environment, which I thought was very interesting, because a lot of leaders have to have that in terms of being very effective in their team. So now that we got to the video, now I want to go over career advice that I got from talking to people from many different aspects of the health system. I think the most important one I talk about is just building relationships. Like I said before in my last video, so much of success out of school is going to be on the relationships you have, because anybody that knows who you are, anybody that is willing to work with you, they're going to constantly be willing to help you or willing to work with you in terms of getting a job, in terms of getting a promotion. Those are all very important things, and a lot of success out of school is dependent on how well your relationships are built in the past and how well you're willing to do it in the future. So I think that's something that's very important that I wish I focused on more of, and something that I'm going to focus on in the future as I progress my professional career. Another thing I thought was very interesting was the fact that most people I talk to, none of their paths are straight lines. I think one of the misconceptions that I constantly had about career, especially in pharmacy, was that you do step A, step B, step C, step D, and you get to where you want to get to. But most people that I talk to, from like the physicians that became a coder, developer for like health solutions, to like an EMT that ended up being a managerial position, there is no like one-stop shop to like get your career. There's so many different aspects that can happen in the future, and you never know what's going to happen. So I think the most important thing, which I'm going to go to my next point, is to be constantly curious and be a lifelong learner, because when you're constantly like learning new things and you're interested in new things, it actually will pivot your career into the place where you want to actually be at. And the last point is basically just be a lifelong learner. I think the reason why I say this is because when I actually got to talk to my executive that actually allowed me to have the internship in the first place, I got to see the fact that he's a lifelong learner. And the fact that like when I last went there, he gave me a couple of books, two of them on negotiation and just how to be a better leader. And I got to see that the fact that this person that's so high up in the C-suite is still learning and still constantly trying to be better at the soft skills and other aspects of his work. It just shows me that as a student and a person that's just starting their professional career, I have no excuse not to be a lifelong learner and constantly keep reading more, learning from other people, and just constantly being a sponge in terms of learning as much as possible. And I think that's one of the main things I took away from that entire internship, was that there's so many ways to improve in the future of your career, that you constantly just have to be curious and lifelong learning, and you'll eventually get to where you want to get to, and you'll be in a lot better place than you are now. So with that, I'll end the video off here. I hope you guys enjoyed the video. Catch you guys next time. Peace out. Bye.